Depression treatment tips. To get better, you need to take an active role in your treatment. You can't be passive as a patient. You and your doctor have to work as a team. You may not feel like taking an active role in anything. You may have doubts that treatment will help. You have to push yourself. Depression can make you feel helpless. Taking charge of your treatment is one way to feel in control again. Be your own advocate. Here are some helpful tips from a behaviorist who have worked in mental health for over 20 years. 1. Stay the course. Treatment usually won't work instantly. Antidepressants may not take effect for 4 to 6 weeks or so. Sometimes a medication does not work, and you will need to try another or a combination of different medications. Therapy takes time also, but don't despair. Treatments are likely to work if you are patient, and give it time. Treatment succeeds about 70% of the time with the right medicine and the right dosages. 2. Take your medication as prescribed. Take your medication at the same time every day. This routine makes it easier to remember. Or take it along with another activity like breakfast time, bedtime. 3. Consult with your doctor before stopping medications. If there is one medication you need to stop, your doctor may reduce your dosage gradually. If you stop abruptly, it may cause depression to return. Many people need ongoing treatment even when they are feeling well. This consistency can prevent them from getting depressed again. I take a glass of water to bed every night. I take my medication every night at the same time. 4. Lifestyle changes to supplement treatment. There's a lot you can do to supplement your treatment. Eating healthy foods, high in fruits and vegetables, and low in sugars and fats. Avoid alcohol and illicit drugs, which can worsen depression and interfere with the effects of your prescribed medicines. Be sure to get a good night's sleep. Don't take naps or lie in bed during the day. Numerous studies show that physical activity can help with the symptoms of depression. Start slow. Try taking short walks around the neighborhood and gradually increase your time. Or go to the gym and start slow and build up your speed. 5. Reduce stress. If you have a stressful job, figure out ways to scale back some of your duties. Or ask friends and family to assist with daily hassles at home. 6. Be open and honest. Opening up to a therapist, behaviorist, or mental health professional is not easy. However, if you are not truthful, therapy is less likely to help. Sometimes people are uncomfortable talking about sensitive topics such as sexual functioning, side effects, substance abuse, or suicidal thoughts. However, talking to your therapist about these issues can only help you. Together, you might be able to work out a new approach that works better. 7. Keep an open mind about treatment. You may find new approaches more helpful than you expect, so try to stay open. Your therapist may have suggestions that seem outlandish. They may push you to do things that feel awkward and uncomfortable. 8. Stay the course. You may feel hopeless at times now or feeling you're not getting better. It's important to understand THT. Feeling this way is a symptom of your condition. Give yourself some time and allow the treatment process to take effect. You will feel better again. Please share this information to your friends and family. Reminder to subscribe to my channel. Most grateful.